I'm Dr. Amanda Childress. I'm a doctor of pharmacy, and I'm a holistic pharmacist at the Nutritional Healing Center of Ann Arbor. And I use my knowledge of how the body works, so anatomy, physiology, pathology, and combine that with my knowledge of natural health, and also, my working knowledge of pharmaceuticals, and come up with plans for people to improve their health with natural means or nature's pharmacy. So it's pretty amazing because there's a lot the body can do to heal and repair on its own when given the right chance. And often when you start implementing these lifestyle changes as well as the correct supplements, many people are able actually to get healthy enough to go off of many of their medications, or if they start early enough, they can often avoid their use altogether. So I'm going to talk to you today about how to heal your gut. And this is definitely something I've had to apply in my own health, as well as hundreds of patients every year. So in my particular case, I grew up in a family that very much used conventional medicine. My mother was a registered nurse. And I was diagnosed with arthritis when I was 7. And not to mention, I had a terrible immune system. I had frequent infections, chronic strep. I think the first few years of my life, the first 3, I was on antibiotics every month for strep. So I had all of that going on. So the antibiotics creating, imbalances in my gut. I still kept getting sick. And then once the arthritis diagnosis came along, then I was put on something called NSAIDs. That's the abbreviation for non-steroidal anti-inflammatory drugs. So they did not prepare us for the type of damage that was going to do to my intestinal tract. So I still had a lot of pain, but meanwhile I was having, terrible stomach aches, lots of constipation, and I was having acid reflux as a little kid. So they had me on very strong PPIs. So an example of a PPI would be Nexium. So I was definitely taking a high dose of that for a long time, in addition to Tums and all sorts of other things, and still having, a lot of discomfort. So by the time I was finished with all that, I became completely intolerant to the drugs, and I had a GI bleed. So basically I had bleeding in my intestinal tract, and it was a pretty serious situation. So I had to stop the use of them altogether. But the good news is, even given all those years, so we're talking about 20 years of abuse to my digestive tract, through, my program with the Nutritional Healing Center, dietary changes, correct supplementation, I have been in the healing process for that. And, I had it completely under control, but then in came a significant mold exposure a few years ago that caused a flare-up with my digestive tract. So I'm still in the healing process from that, but it's getting better all the time. And, it's, again, even with all that history of damage, it's really amazing how much healing the body can do. So I definitely have a lot of experience as a pharmacist, as a patient, and also in the realm of holistic health on this topic. So I'm really excited to share with you what I've learned over the years in working with myself and with patients. I'm going to pull up a PowerPoint I made for you and go over the data. All right, so how to heal your gut? That's the million-dollar question. So I'm going to go over some definitions first. I always like to start here so that we know exactly what we're talking about. So the gut is a general term that is used for the digestive tract. It actually means the whole thing. So the tube that runs all the way from your mouth to the anus. And then human microbiota, that's the microorganisms or the small little bugs in and on the human body. And then the human microbiome actually more specifically refers to the genetic composition of the human microbiota. So this term is often used to describe the microbiota as well as the genetics of it. So I really never hear people say microbiota. They always talk about the microbiome, which is fine. I just like to give you the precise terminology. And then dysbiosis. So basically, it just means that microbial balance is off inside the body. It sounds very fancy when you use the full term for it, but that's really all it refers to. There's many, many ways this can occur. So what actually causes this to happen? What disrupts gut health? This slide could actually probably be 5 times as long, but I'm going to tell you some of the most common things that I see and speak a bit generally about it. So dysbiosis disrupts gut health. So there's thousands of things that could throw things off of balance, but having the microbes that colonize the GI tract off, leaky gut, which we'll talk about more in a moment, hidden infections, medications, gallbladder dysfunction, and other types of poor digestion. So let's talk about dysbiosis first. So, you hear a lot about the microbiome or microbiota, and, it can sound pretty trendy and, hard to determine the actual importance, but it's so important that the government has been studying it for years. So there's a project called the Human Microbiome Project, and there's a link to it right here. It's funded by the National Institute of Health. It is actually started in 2008, and they haven't even really scratched the surface. There's still so much that's misunderstood or not known about the gut. But basically, the goal of this project is they want to figure out how to more precisely describe the human microbiota and how it impacts human health and disease. It's actually a pretty cool project. You can access all their raw data from this link, but it's very, very interesting, some of the findings they've come up with so far and how much they haven't been able to figure out in all this time as well. So symptoms of dysbiosis. So here's some common ones, but definitely there's a lot of other things that can happen, but gas and bloating are some common ones, either diarrhea or constipation, unresolving skin rashes, general immune system problems. So if, someone's sick all the time and they don't get better doing the usual things for the immune system, often there needs to be some gut healing done. Dental problems. If someone constantly is getting cavities or maybe they are even just something simple like bad breath is often a sign that the balance is off in the gut. And then vitamin deficiency, especially if it doesn't respond to supplementation. So here's some conditions that have documented research that they are influenced by dysbiosis. So we've got hypertension or high blood pressure, vaginal infections, also frequent UTIs, for example, migraines, food allergies. There's a lot of skin conditions, even some like psoriasis and eczema, infertility, mood and behavior disorders, dental issues, vitamin deficiencies, again, these are showing up, and actually autoimmune diseases as well. So how did we get here? These are just a few of the things that have substantially impacted people's gut health over time. So overuse of antibiotics, which some of this is due to the inappropriate prescribing of antibiotics. And, even if you never took an antibiotic your whole life, if you ate conventional meat, you've probably indirectly consumed them. They're extensively used in agriculture. Long-term medication therapy, processed foods with genetically modified organisms and pesticides, increased rate of C-sections. So babies actually, part of how they get their initial colonization of their gut is on the way out through the vaginal canal. So they'll actually get some of those microbes from the mom into their GI tract during this time. And then reduced rates of breastfeeding. So there's a lot of immune factors and things that help to improve the health of the gut that comes from breast milk. So we'll talk about, all of those could be a whole workshop in and of themselves, but I just want to give you a general overview of the problem. So back to this idea of antibiotic overuse or misuse. This is a chart from the CDC. You can find this on their website. So basically, the darker the color, the more that antibiotic prescribing that occurs. And you can kind of see, down here in the South, there's definitely a pocket where there's tons and tons of antibiotic use. And then when you go out to the West, definitely far less. The CDC is estimating at this time, or at least with this 2018 report, that 1 in 3 antibiotic prescriptions are actually unnecessary or inappropriate in some way. And this has actually come down a lot because a previous report just from a few years ago, before this one anyway, said that it estimated about 50%. So it does seem to be improving. There's definitely more awareness about it, and different variables as far as people's access to health care. But yeah, this is still a lot of antibiotics being prescribed every year. So how do you fix it? Well, there's the obvious answer. You can, take less antibiotics if possible. And then we look at also supplementing probiotics. And in that way, you can also, if someone does this while they're taking antibiotics, they can mitigate some of the effects typically. And then also some people may need to do it over the longer term. So people ask me a lot, sorry about that, why or should I be taking a probiotic and what is it? So just a general overview of probiotics. These are actually bacteria and fungi that contribute to the well-being of their host. So these are the beneficial as opposed to pathogenic microbes. And, there are actually some occasions where if you get too much of a good thing, then it can create some problems or dysbiosis as well. But in general, these are what you want to have colonizing your gut. And this whole concept came from Louis Pasteur's work. I'm sure you've heard of him and the whole pasteurization process. And that's on the end of identifying pathogenic bacteria and how to take care of them. But Louis actually had a colleague named Elias Mishnikov, and he actually introduced the probiotic concept. And he actually just observed that yogurt consuming Bulgarians lived longer, and then started looking into what is it about yogurt that contributed to their health. And, it wasn't necessarily the yogurt itself, but the microbes that you introduced into the GI tract from eating it. So with probiotics, a general pearl you should know is that you need to supplement them for at least 8 weeks. And, most of the resources I've reviewed in literature say you need at least 100 billion CFU or colony forming units for it to be effective. I find that this may or may not actually be necessary to do that much if you get the right strains. But there's a lot of different strains that we'll talk about. But the point of this is I've talked to a lot of patients and I ask them if they come in with a gut issue, have you used a probiotic before and how it went? Because sometimes that can tell me some more information about their health issue. And typically they'll say, yeah, but it didn't work. And most of the time when I ask questions, they didn't necessarily even take it more than a month and they didn't take it consistently. So that's definitely not enough time to see what it's going to do for you. And, the other question I get asked is, should I be taking a probiotic? And, with me talking about all the benefits of probiotics, you're probably going to assume I'm going to say yes. But the answer is maybe yes, maybe no. So it's not necessarily something everyone needs all the time. But a good hint that you may need additional supplemented into your regimen is if you're often ill, if you have severe digestive issues, a history of heavy antibiotic use, antifungals, or steroids. These are all things that can definitely zap the microbiota. So then I get the question of, well, what kind of probiotics? At least if you're savvy enough to realize that all blends aren't created equally. And the answer to that is, again, it depends. Everyone's needs are different and they can actually change over time. but a good hint is going to be your trouble area. So if you're a woman and your main trouble area is you're getting a lot of vaginal issues, then you want to look at primarily lactobacillus strains. These are super easy to find. You just go to the health food store and find the women's health ones, and those are usually designed that way. And then if your problem's more gut health or oral health, then typically you're going to need a broader spectrum probiotic. So I've tested tons of different probiotics over the last decade and used them in patients. And my favorite that seems to be the most evergreen or broadest application to get results in the broadest number of people is one called Flora 12 Plus from Energetics. So it has 12 strains of probiotics, one of which is actually a beneficial yeast. And the plus is for the prebiotics. So think of that like food and or housing for these beneficial microbes so that they don't just pass through the GI tract, they actually take up residence there. And for baby health, there's a couple of strains that are super beneficial called B. bifidum and B. infantis. Infantis might be a little clue for you. And it's actually good to have these supplemented for good gut health, as well as a good immune system from a prenate on through 2 years of their life. And, to a degree, this may or may not be as important if a baby, is being breastfed with good quality breast milk. And by good quality, I mean the mother's in good health and eating a good balanced diet. And also, if they're getting their first foods introduced correctly, which if you're interested in that, the Weston A. Price Foundation has a very, very nice, well laid out first foods article for parents on how to introduce food in what order. Will set your baby up for very, very good health. Okay, so there's a few strains I'd like to give special mention. So there's one called S. thermophilus, and this is actually a strain of strep. And, I heard a speaker talk about this once, and he said he called it the good strep. They said, even bad families, which, okay, whatever, but even bad families at least have one good member. So strep definitely is known for a lot of its ill effects, dangerous to health. But the strep thermophilus actually has a lot of very beneficial properties. So it eats up excessive ammonia in the system. Now, one case where someone may get excessive ammonia would be if they have kidney failure. So I definitely always make sure to get some S. thermophilus in if someone's kidneys are failing, because it'll help get rid of that excess ammonia. And then it also fights bad strep. So, it'll stick up for you against, the bad strains in its family. So in 1917, physicians were actually using this as a gargle for strep. I don't have a standalone S. thermophilus. However, I have myself and had some patients gargle Flora 12 Plus before if it seems like they're developing strep. It tastes terrible. I definitely didn't make friends with that recommendation, but it definitely did help get the situation under control. So it's just something to think about. And then Saccharomyces boulardii or S. boulardii. So this is yeast that outcompetes Candida. So it's great to put along with antibiotics to prevent yeast overgrowth, because one of the great values of this is, it's a yeast, so most antibiotics aren't going to touch it, so it's still going to be active in your system. It does show some activity against certain parasites. One notable one is B. hominis, and it's definitely one of my go-tos if a patient has SIBO, which stands for small intestine bacterial overgrowth. And, people with SIBO often, they're going to have a lot of upper abdomen bloating and discomfort, especially after eating. It's going to be especially triggered with sugary foods. It's definitely, if those are the symptoms, it's definitely not diagnostic because, fungal overgrowth can do that too. So it's kind of hard to differentiate. There's some breath tests and gut tests you can do to kind of figure that out, or you can start with muscle testing and start to work on that. But, in those cases, if you give someone bacterial overgrowth, a lot of probiotic, sometimes they actually feel worse. So if I find out a patient's done probiotics before and they felt bad, then a lot of times I'll start them on this S. boulardii, and it tends to go really well. I recently had a patient start this, and after just a few weeks, he told me he had formed stools for the first time in many, many years. Okay, so I'm going to move on to the next topic, which is leaky gut. Um, and a lot of us hear about it, but you may not understand what it is. But basically, you know, through your intestine, it has to be somewhat permeable, or things have to transmit across the gut wall. So this can relate to, nutritional factors like certain B vitamins and so forth. They actually have to be able to move in between the cells in the gut, which these things are very, very, very small. And so it's fine that they can pass through. But in the case of leaky gut, these tight junctions, as you would call them, within the wall or the membrane, they actually start to loosen up and the spaces get too large, which means not just the things that are supposed to cross that barrier do. So things like food particles, bugs, which is, the term I'm using for microbes, toxins, these can leak into the bloodstream and other issues. And it can be a very, very, very slow leak, and it may not be super apparent. That can happen over the longer term. A lot of gut issues to greater or lesser degrees, this is going to be a complication of it. Because, if you've got a lot of inflammation in the intestinal tract for a long time, that can happen. But I just want to make you aware of leaky gut. So leaky gut symptoms, a lot of these digestive issues and things we're going to talk about are going to have similar, symptoms, because that's just kind of all dysbiosis, how it works. But gas and bloating, immune system problems. So if someone just keeps getting sick over and over, even though it seems like you're doing everything right, this can be an issue. Again, diarrhea or constipation, skin issues that don't resolve. Had a lot of little kids with strange skin rashes that don't go away. Some that even look a bit like warts, that you get them, you start giving them leaky gut supplements, and eventually over the longer term, those skin issues, I've seen them 100% resolve. It's been pretty impressive. So, and then often you have to add, and if it's warts, an antiviral component too, but you have to address the actual gut wall to get them better usually. And then, there's a strong link that's been demonstrated through research with Crohn's, which is an autoimmune gut condition, irritable bowel syndrome, and celiac disease. So I have a leaky gut protocol, and I've helped so many people with variations of this protocol. But what I'll tell you is, I'm going to show this to you, but it's changed a lot, over, the recent few years, because I found a way to shortcut it. But usually what we're going to do is a tailored elimination diet. So some of my favorites are going to be the Whole30, which I'm actually on right now. I do it at least a couple times a year as a reset. Carnivore diet, that's in, there's actually some extreme cases, especially in autoimmune gut issues, where patients just can't seem to digest the plant foods, or they react to a lot of the plant foods like nuts and seeds and grains. And so often the easiest thing to do is to get them on the carnivore diet. It gets them one of the more clean slates to deal with. And, see that inflammation start to come way down. And it's kind of contrary to what you hear, because in a lot of these gut conditions, medically they say steer away from red meat. But I find in most of these gut healing issues, the protein is 100% necessary to get that healed and repaired. So I had a patient with something called microscopic colitis, which, there's not a lot of medical solutions for, but I had her, as we did variations of this protocol along with some detoxification, and I had her eat more protein, and she actually resolved pretty quickly, to everyone's surprise. So she periodically sends me messages letting me know she still has high quality poops, which is, a big deal. If you've ever had a disturbance in your bowel movements, you understand what a big deal it is and what a relief it is to have good ones. So, that chronic diarrhea really seemed to respond to introducing more protein. And at first it had to be more like in, really high quality, clean protein shake, but later, with more meats and other sources too. So this can definitely be a very useful tool in more extreme cases. The diet called the GAPS, or gut and psychology syndrome. What I like about this particular diet, it's very, very tough to do. But some people were able to modify it a bit to get them through it. But the idea is that you're actually healing and repairing the gut so it can tolerate more foods over time. So it stands for gut and psychology syndrome. This was actually developed by a neurologist in the UK as a way to refeed the gut so it heals and repairs, and it utilizes a lot of bone broth and fermented foods. And then L-glutamine, so that's an amino acid that's needed for the health of the gut wall and to heal and repair tissues. So it's not just needed by the gut, it has a lot of action other places too. So one of my favorites for gut healing is one called glutamine PLGU powder. It has some additional gut support, like licorice and marshmallow root and that sort of thing. I don't use this as much as I used to because I found that, if we do some of the other steps I was telling you about, not as many people tend to need this. So we'll get back to that in a minute. And then probiotics. So some of my favorites are Flora 12 Plus from Energetics. There's one called CT Spore from Cellcore. And I'm not going to talk much about it because I don't think it's available right now, but it is a spore probiotic. So it's geared more toward creating a balance that gets rid of pathogens as opposed to just creating a healthy environment. So that can be really beneficial if someone's got an infection. And then Pro Symbiotic, which is similar to Flora 12, but probably not quite as powerful. It's the standard process version. So it's actually very easy to take. So I love to use that in children because you can open up the powder, and it actually, a lot of kids think it tastes like cotton candy. So it's pretty easy to get down. And then B vitamins, if you need that to heal and repair and to support your overall health. But if you've got leaky gut or other gut issues, you probably aren't absorbing them very well. So I like to use one called methyl B12 spray. It goes right under the tongue. So, and it has the B12, B6, really easy to integrate form of folate. So that's been super beneficial. And then digestive support for their specific trouble area, which can vary from patient to patient. So this is probably the thing that is senior to the actual leaky gut issue, because if you have leaky gut, the question you really should be asking is, well, why is it leaky? And in a lot of cases, this is either going to be hidden infections or toxicity, or a combination of the two more commonly. So hidden infections, these are hidden because they're not found or diagnosed. These can be really tricky to locate medically because, if you do a stool sample, sometimes, especially when it comes to parasites, it's kind of like winning the lottery to get it in that stool sample. So it can be really, really hard. And this is where muscle testing can be so helpful to figure out where to target. So we got bacteria, that would be in SIBO, fungus, mold, SIFO. And honestly, with a lot of these bugs, so we got parasites and viruses. With a lot of these bugs, it's not just the bugs themselves. Actually, more problematic can be the toxins they excrete. In the case of mold, mycotoxins, for example. So this is one of the most important facets to healing your gut. So I want to go over this really quickly because this is kind of the pathway that you have to go to heal your gut. And I have borrowed this from Cellcore. They're nice enough to make this roadmap. And what we have here is, number one, there's certain order to how you do this. So a lot of patients kind of want to start in the middle and really have to kind of start earlier. So phase one is energy and drainage. So you have to make sure that your body can actually eliminate properly before you start massively trying to clean it out. And that, all areas are clearing. And then once you have that under control, someone's able to have bowel movements. If someone's constipated and you try to do a heavy detox, whether it's from parasites or toxins, you can really sometimes get them in trouble if you don't take care of the drainage first. And then gut and immune support. So that's often where you start working on, the healing and, getting rid of things like parasites and the microbes in the gut. Then you can travel on to whole body immune support. Because if the gut isn't supported, you're fighting a losing battle if you try to target the whole body. And then after you can get to a lot of the detox, so getting rid of the harmful elements. And then once you've got all that starting to clean up, then you can start deeper immune support. So cleaning up things at a cellular level. So that's important to know, because if you start back here, you're going to fail. If you start all the way at phase 5, you haven't done phase 1. So Software has a whole protocol about how to do this. There's some cases where I might use the full protocol, but more often than not, I'm going to personalize a specific program for the person. So I'm just going to show you this because these are some very, very powerful products to support the immune system and remove intestinal residue. So this is part of the phase 2. Now, you may have to do some preliminary work before you get here. There's a couple of products in here that I really want to mention, and one is the Biotoxin binder. This definitely, when I started muscle testing with Biotoxin binder using in patients, this is one of the products that was a practice changer, because it works so well and it's so well tolerated compared to previous products that I've used in this arena. So, a lot of people with a lot of bloating and diarrhea, they maybe have experience with charcoal or experimented with it. And it can sometimes help with symptoms, but basically charcoal is a spent carbon that's been burned, the energy's out of it, and it can, like a sponge, suck up toxins. Biotoxin binder, however, it has different size carbon chains, so small, medium, and large. So its action can, unlike charcoal, leave the gut and go clean up other areas. And in addition to being able to pull toxins out, it also has fulvic acid in it, which is actually organic material that can help support and tissue build. So it can pull as well as tissue build at the same time, which makes it such a good product. I have a few chronic diarrhea patients that, I throw this alone on board and they're probably 75% better pretty quickly. Or people, I had, a patient a few years ago, young, healthy, exercising all the time, eating a healthy diet. She'd already seen naturopaths and was taking tons of the best anti-fungal sort of herbs. And she still was struggling. And I put her on Biotoxin binder, and it resolved finally because it was able to pull the rest of that out. So she sent me probably 5 patients in, specifically people she knew that wanted to buy this product, which is not necessarily appropriate for every person, but it can really help in those types of cases. But don't confuse the fact that it says binder that it's going to constipate you. So even people with constipation, if we can get the bowels moving, this is often a very, very healing product. And then we got some parasite support here, and definitely some drainage support for the kidneys, the liver. Again, I am going to customize a program for someone, but the point is, addressing parasites with these particular products. I don't think the Nutritional Healing Center has ever seen so many parasites come out of patients as when we started using these products. So, especially Para 1 and adding other anti-parasitic herbs with it, whether it's Para 2, Para 3, or other things like wormwood. Since Para 1, I've had lots of patient reports of, passing worms that are anywhere from 5 to 12 inches long. And often many of them, it's actually pretty shocking. I've seen pictures of things I'll never be able to unsee, but still it's very exciting to do that. And then there's also a product called Tudka Plus. I actually think they just they renamed this to advanced TUDCA. This is a component of bile that helps to thin it out and push bile through the liver gallbladder. So in that regard, it can be cleansing, it supports digestion. It's been studied in all sorts of conditions. So it's a very exciting product. It's again, one of those products that when it's right for someone, I've seen this alone within a week. I had a patient that, for over a year, she had horrible digestive problems. We added this on and she was 75% better. And another patient that her progress wasn't as quick. It probably took more like, closer to 6 months plus, but a young woman was having chronic nausea, and we added this in and she had a big turnaround with primarily just this product and a couple other light things. So these are really good, but again, if it's the right thing for what you have going on. So the other thing I referenced as something that can affect your gut are medications to such a huge degree. So an obvious one is going to be chemotherapy. I mentioned those non-steroidal anti-inflammatory drugs. Oh, these are notorious. They actually affect how the acid pump in your intestines work. That is kind of like one of the side effects that happens because, part of that inflammatory process in the body is you get some inflammation in the stomach. It's a signal for your acid pump to turn off. This is like the feedback. Hey, there's too much acid here. Slow down, put on the brakes. But if you're staunching the inflammation, and it also happens within the intestine, that pump doesn't know when to turn off. So it's not something you can just take food with it and stop the effect. So these can be very, very tough. Some antidepressants can actually dramatically affect how your gut functions. Antacids and PPIs. This can actually be a big problem because a lot of times they're misused. People get put on PPIs or proton pump inhibitors or other things because the proton pump inhibitors also work to shut down the acid pump. But antacids to help get that under control, that can cause some other situations in the intestine. Some blood pressure medications, antipsychotics do quite a number on intestinal health. Metformin, so this is one of the most commonly used drugs for diabetes. It wreaks so much havoc on the intestine. So people definitely develop, like there's known vitamin deficiencies you develop because secondary to what it does to the gut. So you can't really transport your Bs as well. So it's if you're on metformin, you need to be on folate and you need to be on B12, no question. Antibiotics, which we already talked about, and bisphosphonates, which these are for building bone. Like an example would be Boniva or Fosamax. These can be very, very corrosive to the esophagus. So in fact, when you take those drugs, you're supposed to stay upright for a while after you take it for that reason. That's just a few. And then I want to touch on the topic of toxicity. We've covered so much, I don't want to spend too long on it, but we've got glyphosate. I don't know if you've heard of glyphosate, but it is also known as Roundup. So it's hugely in the environment. I mean, if you live in a apartment complex or condo, it's often sprayed outside or something like it is sprayed to keep, the landscaping looking nice. And even if you completely control your yard, you have neighbors that are likely using this in the cracks of their pavement around their house and the dandelions out. So, we have huge exposures. And not only that, 85% of the engineered crops are engineered to tolerate glyphosate-based herbicides. So, there's a lot of, obviously it's still on the market, but there's a lot of pending lawsuits about this and have been for years. And there's some really compelling, photographs that you can find online of the impact it has on wildlife and, fertility in wildlife and birth defects and so forth. So, this is definitely a chemical that we're all getting exposed to. So, average annual use of glyphosate by crops. There may be a more updated version of this. This was a little bit older. But there's soybeans, corn, cotton, really high up here's wheat. So really, really high numbers. And these are actually some of the top allergens, coincidentally here as well. So it's if you're not getting organic, and to a degree, maybe even if you are, you're gonna get a lot of exposure from these foods. Okay, so some conditions associated with glyphosate toxicity. Man, a lot of these mimic things that are being studied in just dysbiosis in general, but rheumatoid arthritis, low thyroid, obesity, Alzheimer's, Parkinson's, liver damage, um, birth defects, late-term miscarriage, infertility, anemia, and other deficiencies, cancer, and celiac disease. So that's a pretty hefty list there. All right, so one of the products that I really like for cleaning up glyphosate is from Cellcore. They have just phenomenal and well-tolerated detox products. I haven't seen their match before. So this is Hmet Binder, stands for Heavy Metal Environmental Toxin Binder. And it's definitely something that if you use it, you need to be ready for it. So there's a lot of preliminary steps most people need to do. You can't just say, oh, well, I'm worried about glyphosate and start taking this, because in a lot of cases, you're not going to feel very good and it's not going to go well. But this is geared toward helping with glyphosate. The other thing I didn't mention is that, glyphosate has this really clever way of getting into joints and displacing copper and glycine. So it's definitely can expedite joint problems and joint replacements, because you've got to have the right nutrition and minerals to strengthen joints. Okay, so next we want to talk about specific areas of the digestive tract that need to be supported to heal your gut. And, I'm going to talk about gallbladder dysfunction because I see so many people who have a gallbladder problem. They don't know it, they suffer, they try all these different things. Maybe they're told they have irritable bowel syndrome, when in fact, it's just they have a misdiagnosed gallbladder problem. And it's really hard to find this unless you have obvious stones that they find on an ultrasound. They're not going to realize this until your gallbladder is in so much trouble that it's ready to be removed. So definitely muscle testing, or sometimes even just recognizing the symptoms of it, can help you start working on healing and repairing your gallbladder before you get to surgery. So I think it's worth noting that, the liver makes bile. It goes into the sac called the gallbladder, where it sits and waits until you eat. And then it gets released through the bile duct into the stomach to help digest your food. There's a common bile duct, meaning it's shared by the pancreas. So together they release, the pancreas release enzymes and things like pancreatin to help you digest your food as well. So if you get a stone lodged in here, sometimes depending upon where it is, you can actually choke off the duct to the pancreas. That's why, we've heard of people with gallbladder issues that persist and they end up in the hospital with pancreatitis. So you got to keep this clean and moving. So, if you have your gallbladder removed, you're probably going to have some digestive repercussions from that. And so I've had, again, multiple patients that come in with all these horrible, like chronic, either constipation or diarrhea, most commonly diarrhea, where they're having cramps. And, really all I had to do in a couple of these cases is just give them something called Colacol, which is from Standard Process. It has bile salts and collinsonia root. So you actually put the bile salt in there, with food, so that you can amp up the bile during the food times rather than just the constant release. And that can give a lot of relief. So there is life after gallbladder removal. We like to prevent it when possible, but if you're having symptoms, you don't have a gallbladder, you probably need some bile replacement. And then, stones can get trapped in here, and you're not always going to catch these through conventional medical tests. Sludge, so even if you have stones, sometimes the bile gets really gummy or thick and sludgy, so it gets stuck in there and moves slowly. And then, some of these problems can actually cause a spasm to happen too. So I remember one time in my 20s when I was having a lot of digestive trouble, I remember I had to bend to the side. On my right side, I bent. And when I sat up, because I was picking something up, and when I sat up, I felt I was going to pass out. I had such terrible pain. It felt like something was doing a flip flop in my side. And it passed. I had no idea what it was. And now looking back, I know that was a gallbladder spasm. So I'm lucky enough to say that through everything my body went through, my gallbladder was probably, a great candidate for removal, 15 plus years ago, but yet I still am maintaining it. So there is hope. So common gallbladder symptoms. So if you got pain in the right side of the rib cage, right where the bend is, so if it aches or hurts there after you eat, now this pain actually can refer, transfer to other areas, especially in women. Women tend to have a lot of referred pain with gallbladder issues. So it could be in the right shoulder, some chronic right shoulder pain that's unexplained if there's no damage in the shoulder, or kind of in the back for the blade area, heartburn, nausea. If you lose your taste for meat, it's probably because you're not digesting it very well. And if you have gallbladder dysfunction, that definitely you won't digest meat or fat very well. So intolerance of fatty foods. If you just notice, there's bad fatty foods that would make anybody feel bad. If you have like a huge greasy cheeseburger and greasy French fries, but if you notice, even if I don't go that crazy, or you've got that concentrated pain in your side, could be a sign of the gallbladder. And then gas and bloating is very, very common. So, if someone's particularly gassy, there's other reasons, but, if you've got multiples of these, it might be worth examining gallbladder as a factor. So gallbladder support, here are some of my favorites. There's definitely tons of other choices, but we've got fast food. This is one of my favorites. We've definitely been able to keep many people out of the hospital for gallstones and kidney stones with this particular supplement because it's food grade phosphorus. So it works like a ringer for the liver gallbladder, and the phosphorus will help to dissolve deposits like stones. So it can help smooth the surface so that they can start to dissolve and move. So I definitely, if I go out of town, I'll use it. It can be great for nausea. Or, if I eat something out of my routine and things get stirred up, then I can definitely take this. So this is definitely good to have with you. And then cholesterol, which I already talked about, or other bile salts. And then there's a supplement called choline, which is another one of my favorites. It's actually a form of a B vitamin, and it helps with the emulsification of fat. So it can be phenomenal gallbladder support, as well as sometimes it actually helps to support brain and mood and sleep too. And then advanced TUGCA, which I already talked about, to thin the bile and get it moving through the liver, gallbladder, and through your system. So those are my favorites. And then there's other types of poor digestion. There can be issues, that intestinal tract is very, very long. So there's definitely other things that can happen. But I want to target some specific poor digestive issues. So some people have too little acid, and this can actually relate to acid reflux or GERD. And these people are going to have a lot of distress after eating protein. So if they eat a big steak and they feel awful, often they don't have enough acid to digest it. Now, one of the problems is medically, if someone has too much acid or has like symptoms of acid reflux or the reflux in their esophagus, first thing they're going to get prescribed are things to lower acid. But what can happen in a lot of these cases is they actually didn't have enough acid in the first place. So then the food sits in the stomach, it can't move because it's not yet digested enough. and it can putrefy. And then the body's still throwing in more and more acid. It just kind of sits there and it can start to wash up into the esophagus. That's why, I mean, I think a lot of people have heard by now that taking a swig of apple cider vinegar gets rid of, you know, reflux for a lot of people. This is why these are people who had too little acid. And, you know, if it burns, you shouldn't do that. Like if you feel it burning down your esophagus, that doesn't necessarily rule out the fact that you have too little acid, because it could be you've had reflux for so long, the esophageal tissue is just too irritated to handle, you know, the acid going down. So you might be try capsules of apple cider vinegar and see if that goes better. But in some cases, people actually do have too much acid, and that will also give you acid reflux or GERD. It can also lead to ulcers. So in these cases, I usually like to recommend stuff like, oh, actually, I think I have that on another slide. There's different support I recommend for that. And then pancreas dysfunction. So remember that picture of the bile ducts? You saw the tube where, you know, the enzymes from the pancreas come from. So pancreas dysfunction can actually cause trouble digesting salads, trouble, you know, handling sugar. And, you know, in this case, you need enzymes more specifically. So these are some of my favorites for these different areas. If you have too little acid, there's apple cider vinegar. There's also Zypan, which is a tablet form of hydrochloric acid from standard process, or betaine hydrochloride. These are both possible options. If you have too much acid, we're going to do something more like aloe to help calm and soothe, or a supplement called Gastrex. These are the Gastrex is standard process. And then for pancreas dysfunction, there's an enzyme that has pancreatic enzymes called multenzyme. Again, that's standard process. Or one called DS Digest. This is from Systemic Formulas, and it's a blend that has definitely a lot of pancreas helping factors, or pancreatic enzyme type factors. So now, just as a wrap up, we covered a whole lot of areas, but how do you heal your gut? Well, it's very simple, right? Actually, it's a little complex. These are all the areas you have to look at. You have to get the correct diet for your body. You may need help figuring that out, but you need specific elimination protocols based upon your symptom profile. So I hope I gave you a good enough background to get a better idea of where to go. Really, the one that I prefer most generally is the Whole30. It's going to take out grains, dairy, beans and legumes, all sugars, chemicals, artificial stuff. So you're just eating meats, vegetables, fruits, good non-dairy fats. So your diet, it's really nice and clean and kind of a common sense, good food to nourish your body. And then after you finish that 30 days, you can start a reintroduction. But I've had a few patients I had a patient that started with me in the pandemic. We did a phone consultation because the office was closed for patients. And, you know, I said, you know, if you want to get the most out of this, just do the Whole30 first. And she did the Whole30, and I ended up basically only having a patient for 1 month because, you know, she got better, which is phenomenal. So it's really, you know, definitely a good, healthy way and a good nutrient dense way to kind of figure it out. Now, there are some people that's going to be hard for them because maybe they can't digest, you know, meats and vegetables very well because their digestion's so upset. So they may have to have a more specific protocol. And you got to address those hidden infections and toxicity. I talked about a few of my favorite products, but, you know, kind of what you've got going on is highly individual. So it's good to have some direction with how to go. And that's why muscle testing, and even some tests, like their stool test, you know, we can recommend that are really good at isolating these things, and some blood tests too, depending upon your health history. And then digestive support and organ support. Again, this is going to depend on you. If you don't have a gallbladder issue, it's silly to give you gallbladder supplements, and those might actually give you diarrhea or make you not feel good. So, you know, it could be maybe you just need support for the intestine or more the leaky gut protocol, or, you know, maybe it's the pancreas you need supporting. So that's where it's good to have some support. And then the final thing that I'm saving for last is fasting. So, you know, I don't think anyone likes to hear this, unless you're just a fasting enthusiast. But, often fasting can be a very healing way to help your system. And so fasting, why fasting? It gives your digestive system a chance to rest. So your gut is working constantly. And, you know, unfortunately, what a lot of us do is we eat our biggest meal at night, not long before we're going to go to bed, which means that at night, when your body's at rest and trying to heal and repair, your intestinal tract's working really hard to try to digest this food when it could be doing other body maintenance. So, fasting and cutting off eating, even if it's just a few hours, like at least 3 hours before you go to sleep, that can help a lot. I have a lot of people with bloating that just resolves from, not eating in the evening. And if you tried everything and you have really resistant weight loss, sometimes, you know, stopping eating earlier in the day can make all the difference, or cutting out that bedtime snack if you're snacking. So I mentioned it allows the body to focus energy on healing. Um, there's a few exceptions, but most digestive symptoms alleviate when fasting. If you are someone that you go a long time without eating and you feel worse, like you get acidic, you can be one of those too much acid people. So the body's so used to eating, it's going to release that, digestive factors and produce more acid when it's expecting food to come. So you might not be a good faster if that happens. And it could be you can work up to it later, but it's just not the right time if you're not feeling good when you do it. And also reduce inflammation, and again, takes the burden off the pancreas and can help improve insulin resistance. So there's different ways to approach a fast. It depends on you. So the easiest way to get started, because if you've never fasted, you've always eaten like 3 meals a day plus 2 or 3 snacks a day. If you start like a complete fast, you might pass out. It may not go well. You're probably gonna be miserable. Your brain won't work. So a good way to start is intermittent fasting. Basically, you just shrink the window of time over which you eat. So no food for 14 to 24 hours. So I recommend just start shrinking it up and do it to your tolerance and find out what feels good. Don't push it too hard if you don't feel good. And, if some people don't even go a full 12 hours without eating. So if you've never done that, start there, see how that goes. If you do that, fine, start expanding it and find that area where you feel good. And it could be maybe you can only, fast for 14 hours, but then you do that for a while and you realize, oh, I'm processing food better. I can go longer. And it's easier if you're eating good quality, nutrient dense foods and getting enough protein during the window over which you're eating too. Then there's bone broth fast. So you can do a mini fast. It can take a lot of stress off your digestive tract. If you just drink bone broth and water and salt. Some people still do their coffee, and you're okay if you have to, fine. It's better if you don't, but whatever. But you're still getting healing factors from the bone broth. You're still, getting some nourishment, a little bit of easy to digest protein, but your digestive system doesn't have to work hard to process that. So sometimes you can do this for, just do it to your tolerance. If you can only do it for a day, fine. If you need to incorporate that when you first start intermittent fasting during your fasting time, okay, fine. Like do what you need to do to get the body ready to tolerate that. Then there's water fasting. This is for more advanced fasters where you do only salt and water. I've most commonly seen people do this, from 1 to 5 days. I've had other patients that do it longer, but they've been fasting for a very, very long time and have very, very good blood sugar handling. So it's not something you want to do without, working up to and making sure your body can tolerate it. And I usually recommend, break the fast if you're feeling woozy or faint or, there's other schools of thoughts about how to do that. That's just how I apply it with patients. And then there's also something called dry fasting, which I'm not going to talk about because it may have some application, but it's definitely has the potential to cause some problems. So you definitely would want guidance if you did something like that. So that is my workshop on how to heal your gut. Hopefully you got some answers. If you are finding that you have more questions than answers, or you have a specific question about my workshop, you can email me. This is my my email address, dramanda@nhca.com. But you know, if it's you totally understood what I said, it could just, and you need more guidance, it could be that you just need to be a patient. So you can call the office or email us at the Nutritional Healing Center of Ann Arbor. This is our website. Our phone number, I am remiss in putting up there, but it's 734-302-7575. And I'd be happy to help you to heal your gut. Thank you for joining me and have a good night.